Hi, this is Dr. Rosenberger with Appalachian Spring Dermatology, and today we're doing a series of videos about laser and intense pulse light. The last in the series is this one about treating leg veins. So when we're treating leg veins, we use a laser, and again we use a 1064 ND YAG laser. When we're treating veins, it's a little bit different. We actually change the spot size, meaning how big the beam is that comes out. So if you can see on my hand, this is the biggest spot size. We would use that for very big veins versus this little spot size works for the smaller veins. So depending on the size of the vein and how deep or superficial the vein is, as we do the procedure, we alternate and alter the settings and the size of the spot size. So the deeper the vein is in the skin, the bigger we make the spot size. The more superficial, the smaller. So this is a sort of cardinal rule in dermatology. The deeper you want to go, the bigger you make your spot size. So when we're treating veins, we're targeting blood in the blood vessel. So what the laser will do is heat up the blood in the blood vessel. I like to use the term heat. It's really energy, but it's best described, it feels like heat. So it heats up the blood in the blood vessel, and that heat damages the blood vessel wall. So if you think about a blood vessel like it's a hose, and the blood is like water running through the hose, it's going to heat it up so much that it damages the inner lining of that hose. And by damaging the blood vessel wall, then the blood vessel dies. So we do have patients wear prescription strength support stockings as much as possible for the week after the procedure. Once the blood vessel is treated, we actually want it to stay closed, and we do not want a lot of good nourishing blood to rush in and heal that blood vessel. We want it to stay closed so that it can die properly. Once the blood vessel is treated and it's no longer functioning, the body's cleanup cells come in and actually take the blood vessel away. This process takes a good bit of time though on the leg, so I prefer to do this procedure only from about October to April because it will take at least 8 weeks for the blood vessels to look good. They're often much darker, much more discolored for a significant period of time after we treat them. So keep that in mind, and you will need to bring prescription strength support stockings to the procedure so we can put them on right away. Again, we want to keep those blood vessels closed so that they don't heal themselves before they have time to die. One time in medicine that we actually want something to die. We want the blood vessels to go away. So we'll get started, and I'll do a little demonstration for you. So the patient has a few blood vessels that on her leg that actually were already treated once. Compared to other treatments, a lot of times we do have to treat leg veins multiple times. So I'm looking at leg veins. What we want to see is their blood still flowing through them. So we'll press on the vein and then watch it fill back up with blood. So you can see there are some areas that are still filling back up. So there's some areas that aren't because they're still just waiting to go away, but some areas that are still filling. There you go. You can see that filling back up with blood. So we want to make them not fill up with blood anymore. So again, we're using a 1064 ND YAG. The red light is actually just a guide beam, so we know where the laser is pulsing. And so generally, if you think about these blood vessels, usually they're going to be very much a 3D structure. So sometimes I have to work with these in layers. So I'll treat the deeper layer first and then the more superficial layer. And this does not feel very good. It's very, very hot. And I don't know if you can see, but that little spot looks much better already. You can actually almost feel that blood flowing, that hot, heated blood flowing through after you do the laser pulse. So a lot of times people will do a little jerk sort of like that after a laser pulse because they're feeling that sort of lag in the blood as it flows. So I'm just going over all these areas with the 5mm spot size, seeing which ones I can get rid of that way. And again, those would be the deeper ones. And then we'll go over it with the more superficial one. So with leg veins, you'll actually see even here quite quickly, the whole area is going to get red. Number one, this is very cold, so it's like I've had an ice cube on the skin. And just as the body responds to the what's happening to the blood vessels, it often will get a little bit red. And they'll be red usually from a half hour after the procedure up to 48 hours or so afterwards. So I don't recommend doing this right before. You need to look good. And this is also, again, why we do not do this procedure as much as possible during the summer months. The only time I do somebody towards even the early fall is if they're a snowbird and they're heading south for the summer, or for the winter. They're going to have another summer. And so now when I go over those areas, there's no change in the blood flow. We've closed down those blood vessels. And actually, most of them did really well with this 5mm spot size. So it looks like there's maybe one little guy right there. See that? I don't know if you can see that with the cameras. It's still filling up there in that one spot. So let's see if we can get that. A lot of times I can tell when I've gotten it good, so I'll go back over and press the handpiece on there. I'm pressing the handpiece on there because it's very cold, so it makes it feel better right away. I usually tell people if something hurts, don't pull away from me. Let me fix it, because the putting the handpiece back over it. So usually chill before and after when I'm doing leg veins. Sometimes I'll do that with laser hair removal and other procedures as well, but generally with the leg veins is when I'll chill, laser, chill again. Again, we want to protect the chilling, both makes it feel better, but also protects that outer layer of the skin so that it's less likely for it to be damaged. So again, it'll take 8 to 12 weeks for these to do their thing, but they should look much better. And hopefully that gives you some answers about how we treat blood vessels here at Appalachian Spring Dermatology.
Call for an appointment today and learn more by going to our website at wvderm.com.